Hey, it's Raj from 3CB Performance. I've been asked numerous questions regarding COVID-19, aka novel coronavirus, general and sport specific, but infectious disease is completely outside my scope of practice and expertise. Therefore, I consulted with a trusted epidemiologist and infectious disease expert for a two-part video. In this video, part 1, I used his medical insight and expertise to explain COVID-19 and answer frequently asked questions. COVID-19, CO standing for corona, VI for virus, D for disease, and 19 for the year of discovery, is a virus within the general family of viruses termed, quote, coronavirus, that get their name from crown-like spikes on their surface. Corona is Latin for crown. COVID-19 is also known as, quote, novel, new coronavirus, because it hasn't been seen before in humans, with some researchers alleging that the virus was passed from bats to humans through an intermediary host, pangolins, which are highly valued in China for their meat and scales. Other examples of coronaviruses that spread from animals to humans include Middle East Respiratory Syndrome, MERS, and Severe Acute Respiratory Syndrome, SARS. COVID-19 is spread through, quote, droplet transmission, typically when a carrier coughs or sneezes within 6 feet of an unaffected individual, or an unaffected individual touches a contaminated surface and then touches one's own nose, mouth, and/or eyes. Studies are showing that COVID-19 can last up to 4 hours on copper surfaces, up to 24 hours on cardboard, and up to 2 to 3 days on plastic and metal. There are 2 keys to protecting yourself. The first is to wash your hands with soap and water for at least 20 seconds, especially after you've been in a public place or after blowing your nose, coughing, or sneezing. Further, avoid touching high-use objects like door handles. If you don't have soap and water, use a hand sanitizer that contains at least 60% alcohol. The second is known as, quote, social distancing. Avoid going to large gatherings or crowds, and if you are out, maintain a 6-foot barrier between you and other individuals. Both of these are incredibly important to break the chain of transmission, especially in the early stages of containment, where even one less exposure and transmission can result in exponentially less cases down the line. The research indicates that implementing strict social distancing before 1% of the population acquires a virus during a pandemic can be particularly impactful in the medium and long run. To help protect others, use a tissue or the inside of your elbow when you cough or sneeze, clean and disinfect frequently used surfaces daily, including phones and keyboards, wear a face mask if you're sick or have been exposed to a potential COVID-19 carrier. If you're neither of those, you don't need a face mask, as there's no research showing it reduces transmission to you, and buying them for that purpose strains an already existing shortage of face masks for medical providers, and ideally, to stay at home. If you don't trust me, at least take Wu-Tang's word for it. The key symptoms of COVID-19 are fever, a dry cough, and shortness of breath. The dry cough and shortness of breath speak directly to COVID-19's impact on the respiratory system. If you have symptoms, the best advice right now is to quarantine yourself at home for at least 14 days in order to avoid potential transmission to anyone else. If you live at home with a roommate, spouse, or kids, separate yourself from them. If you develop severe symptoms such as difficulty breathing, persistent pressure or pain in the chest, confusion, severe lethargy, and/or bluish lips or face, seek immediate medical attention. If you don't have symptoms, but find out that you've been around someone who may have COVID-19, isolate yourself for 14 days to potentially stop the spread. Ideally, individuals with symptoms would be getting tested and then quarantined in separate housing. For example, China has quarantine hotels set up, but testing capacity is currently woefully short in numerous countries, including the US, which has the lowest per capita testing of any country early in the outbreak. Populations at the highest risk of becoming severely ill and dying include those who have a compromised immune system, which includes people over 60, and those with existing illnesses such as heart disease, lung disease, diabetes, or obesity, which is often clustered closely with the first 3. each underlying condition results in cumulative risk. To put that risk into perspective, nearly 2/3 of adults in the US have one underlying health condition, 40% have two, roughly 25 million have diabetes, and nearly 33% are considered obese. In accordance with those risks, California has mandated at-home isolation for those older than 65 and or those with chronic illnesses, a plan that may also go into effect in Britain as well. Additionally, there's some evidence that frontline medical providers such as ER docs and nurses are at increasing risk for infection, especially when overtaxed and overfatigued. This isn't to say younger populations can't become severely ill, they're just less likely to. Overall, death rates from COVID-19 are at nearly 1% compared to the 0.1% for normal seasonal influenza. As with other viral infections, it's likely that the body will develop antibodies to fight off the virus and protect them from reinfection. However, we also know that immunity tends to wane over time. Even though researchers have recently been able to isolate COVID-19's genome and human trials are beginning, a vaccine is very likely still at least 1 to 1.5 years away from being finalized, produced, and distributed. Influenza subsides in the warmer months, but we have no indication, information, or knowledge if that's the case with COVID-19. Of course you hope that's the case, but it's a fool's errand to depend on an unknown or factor it into disease trajectory. The hardest part about containing COVID-19 is that it has an extended incubation period, meaning symptoms may take up to 14 days to appear, although in nearly 95% of cases, symptoms do appear in at least 10 days, whereas influenza has an average incubation period of 2 days. That's potentially 12 extra days of going about your normal business and unknowingly spreading the virus. To that point, early research is showing that each person with COVID-19 infects 2.2 other people, which is nearly double the rate of influenza. If lower risk populations don't take appropriate precautions, they can be carriers of the virus that helps it spread through the high risk populations. Early data is showing that nearly 80% of cases are mild or asymptomatic, and data coming from South Korea, which has the most robust testing of any country, shows the 20 to 29-year-old demographic as having the highest proportion of affected individuals. Containment is critical because COVID-19 has an exponential growth curve, meaning there are greater increases as time passes. This exponential pattern has been seen in nearly every affected country thus far, characterized by a relatively low number of cases and deaths early on, possibly creating a false sense of security that eventually explode. The reported cases are also very likely dampened by a lack of testing capacity. Further, and this is the most critical piece to reducing the number of deaths, is reducing sharp spikes in cases so hospitals aren't overwhelmed and can actually meet the demand for beds and needed equipment, such as respirators. You may have heard this called, quote, flattening the curve, and it simply means spreading the number of cases out over more time, preventing the dire situation where MDs have to essentially begin choosing life or death for patients, as has been reported in some hospitals in northern Italy. That danger is a key reason why countries such as Italy, Spain, and France have mandated a minimum 14-day countrywide shutdown and quarantine. Even Austria, which has only 8 million people, has banned gatherings larger than 5 people. The US and Great Britain are tracking on the same pattern, and I wouldn't be surprised at all to see government mandates at some point in the near future. Social distancing in particular is critical right now in those countries because each is currently in the asymptomatic phase where thousands and thousands of unaffected carriers continue to spread the virus and cause exponentially more downstream effects. Accordingly, certain states in the US, notably Ohio, California, Illinois, are shuttering all non-essential establishments. COVID-19, aka novel coronavirus, has placed the health of the world population at the forefront. It's a situation that needs to be taken very seriously, and we're finally seeing countries like the United States and Great Britain take the threat as such. Prevention in those countries is out the window due to lackadaisical preparation and response time, but we can still undertake containment measures, and every single day counts in reducing the number of cases, hospital workload, and deaths directly or indirectly attributed to the virus. In addition to state and governmental mandates, each and every one of us can follow experts' advice. Hopefully this video is a useful primer for you, but the Center for Disease Control (CDC) and World Health Organization (WHO) are robust resources, and limit our own exposure to COVID-19 and limit its spread to others, especially high-risk populations. Stay safe, stay calm, stop hoarding water and toilet paper, stay in control of what you can control, and possibly use this relative downtime to reset and work on habits such as sleep hygiene, fitness, nutrition, reading, reaching out to family and friends, and so on. These are difficult times, but we'll get through this together and perhaps be better for it due to the type of perspective that only seems to come from sobering global events. Lastly, here's a great clip from Dr. Michael Ryan, Executive Director of the WHO and leading global authority on the spread of infectious disease, that succinctly and matter-of-factly sums up what we need to do to overcome this pandemic.
What we've learned in Ebola outbreaks is you need to react quickly. You need to go after the virus. You need to stop the chains of transmission. You need to engage with communities very deeply. Community acceptance is hugely important. You need to be coordinated. You need to be coherent. You need to look at the other sectoral impacts, the schools and security and economic. So it's essentially many of those same lessons. But the lessons I've learned after so many Ebola outbreaks in my career are: be fast, have no regrets. You must be the first mover. The virus will always get you if you don't move quickly. And you need to be prepared. And I say this, one of the great things in emergency response, and anyone who's involved in emergency response will know this, if you need to be right before you move, you will never win. Perfection is the enemy of the good when it comes to emergency management. Speed trumps perfection. And the problem in society we have at the moment is everyone is afraid of making a mistake. Everyone is afraid of the consequence of error. But the greatest error is not to move. The greatest error is to be paralyzed by the fear of failure. And I think that's the single biggest lesson I've learned in Ebola responses in the past.
That's a wrap for this video. Thanks for watching. My goal is to provide you with in-depth, evidence-based, narrative-free analysis. You can always find me on IG and Twitter at 3CB Performance. Make sure to sub to the channel and follow along on all social media for the latest updates. Take care of yourselves and be cognizant of others. We're all in this together. 3CB out.